The digestive system. There's an older term that we don't use much anymore called the alimentary tract, or tract, which also describes the digestive system. We've sort of simplified it now and just use this general term. So this is kind of how we refer to this system in our general common vernacular in English. And we're going to discuss some of the terms involved with the digestive system. We'll get into some pathologies and maybe a little bit of diagnostic medicine along the way. Our first word up, gastrointestinal. So you'll recognize this as a hybrid word. You may recall that when we went over suffixes and I talked about the difference between phagia and phagia, I pointed out that GI was in phagia, and that should remind you that it's part of the gastrointestinal system. The first step in digesting food is to chew, and so hopefully that helped you remember that phagia means the act of chewing or eating. Digestive system, also known as the gastrointestinal system, is comprised of the combining form gastro, and so that's a combining form. Intestine is a word root. We will get that in a combining form later in the lecture, and all, which of course is pertaining to. So technically pertaining to the gastrointestinal system. Digestive system function, primarily it breaks down food, prepares food for absorption, and eliminates waste products. So that is the most basic way of expressing the function of the digestive system. Of course, there's lots of steps in between, but those are the three things we'll be focusing on in this chapter. The GI tract extends from the oral cavity, in other words, the mouth, to the anus. We don't often think of it that way, but it is one continual connection from the mouth to the anus. And so food passes through in various stages and various functions happen to help digest that. And of course, in those different regions, the organs will vary in size and structure. The termination, once again, is at the anus, and this is where solid waste in the form of feces and stool are eliminated from the body by means of defecation. Of course, the study, and you could have guessed that this was probably coming up, since we already know we're talking about the GI tract. We have the study of gastroenterology. It's the medical specialty that treats diseases affecting the digestive system. So that, of course, is our form of study in the GI system. And who performs that study? You got it, the gastroenterologist, physician specialist that specialize in disorders and diseases of the digestive system. And you see here, we haven't seen Blue Man very much this semester, but here Blue Man is to the right in this lower diagram. This is often used in anatomy to help show how things are placed, and they use this blue background because of the contrast. You'll see Blue Man from time to time as you study anatomy. The one thing you want to know about Blue Man is everything in Blue Man is also always so nice and neat and tidy and different colors. And when we see the inside of a human body, of course, it's not like that at all. But it does help to learn. And so you generally will know where structures are when you see Blue Man. We're going to start the whole process of digestion with the word mastication, means to chew. So you have several muscles involved in mastication. You see some of them here. The masseter, is the most powerful of those muscles. You'll see that right there in the jawline. When you clench your jaw and it bulges on the side, the masseter is the muscle that you're flexing. We have the orbicularis oris, is also very important, especially in speech, to be able to form words and to move the lips around and also to help to masticate food. A few other structures here that aren't really relevant necessarily, but they're anchor points or things that muscles are attached to. So it's important to know that that's going on. What you really need to know in this slide, though, is mastication. Mastication means to chew. And when you chew, you create something called a bolus. This is a round, sticky mass of chewed food. So this is where the parotid gland, which you would have seen in the previous diagram I showed you, parotid gland and some submandibular glands and a few other glands in your mouth will start to secrete saliva, which helps break food down. And this helps create a bolus. Those of you who are parents and have ever, or maybe you're not a parent, but you've fed a small child in a high chair before, you're familiar with what a bolus is because it probably got spit back at you or spit on the table or thrown on the floor. So that's the form that we process food in. When we masticate, we go to swallow, and we have the bolus that's that's what we're going to digest. Now, I want to point out one structure in this diagram here. If you look underneath the area that's indicated as a bolus, you'll see kind of a finger-like protrusion that's pointed to the posterior and is pointed up to the superior, so posterior inferior direction. That's something called the epiglottis. When we swallow, our tongue depresses, and that little protrusion you see will close down over the esophagus. Because the back of the throat, or the back of your mouth is shared by two areas. We know we have the oropharynx, right? And the oropharynx is that area back there. We have the trachea and esophagus. So if it weren't for the epiglottis closing the trachea when you swallowed, you could aspirate food into your lungs very easily. And we all know food in the lungs is a bad thing. You don't want to aspirate anything into your lungs except for air. Excuse me. I cough on that note. Pardon me. That's not a corona cough, by the way. So that structure will clamp down over the esophagus, or over the trachea rather, which leaves the esophagus open, and the bolus will then follow the path of the esophagus. If you try to swallow too quickly, like I did just a moment ago, and you beat that epiglottis before it closes all the way shut, you may aspirate food or sometimes water, and you will have a very quick reflex, a very quick cough reflex, basically a phrenospasm that will cause you to cough and push that material back up out of the lungs and back into the mouth. So the epiglottis tries to prevent that. Sometimes we move faster than the epiglottis and we do aspirate something, but usually it comes right back out. Once it's in the esophagus, this bolus now is going to be engaged or going to be affected by the act of peristalsis. So peristalsis are wave-like muscle contractions and relaxations of body tubes, especially in the alimentary tract. Now, alimentary, once again, remember, is just another word for the GI tract. And this contraction helps push food. Let me start that again. This contraction will help push ingested food through the digestive tract towards the anus. So these are sphincter muscles. They're round. One contracts, pushes the bolus down to the next muscle, which contracts and pushes it to the next, and so on and so forth. This process goes on through the entire digestive tract. It starts at the back of the oropharynx, right at the cricoid cartilage, actually, right beneath that. It starts there. It continues on in the stomach, although the stomach does do some churning, but it's a little bit different than peristalsis, but it's very much similar, and you could say that in an analogy, they're the same thing. The peristaltic wave will then continue on through the duodenum and in the small intestine, into the large intestine, and all the way up through where the waste products are defecated. So peristalsis starts when you swallow, and it ends basically at defecation. It's pretty much going on the whole time that you are processing food through your body. And when that peristalsis moves the bolus down to the stomach, it's going to be turned into something called chyme. This is a liquid mass created in the stomach when undigested food mixes with gastric juices. So we have these very strong acids that are created by the liver, stored in the gallbladder, and released into the stomach and help break down food. And when that process begins, and when the bolus meets these gastric juices, chyme is what's created. Not a very pleasant thing to think about, but if you've ever had to vomit, basically that was chyme coming back up. It was partially digested food. It was in the stomach. It was being processed, but for whatever reason, course got turned around and it came back up. So if you've ever witnessed that, which most of us have, you kind of have an idea of what chyme is. And by the way, you always feel that burning sensation in your throat when you have that, right? That's the digestive juices in the stomach affecting the mucosal lining in the throat, or in the esophagus. We'll cover that a little bit later. For right now, we're going to talk about the upper GI tract. This is going to be the mouth, the salivary glands. I already mentioned the parotid and the submandibular glands. They're part of that. Teeth, tongue, and then we're going to move to the pharynx, esophagus, and stomach. And that's all the upper GI tract. So let's begin our exploration. First combining form here, oro. It's a combining form for mouth. This is not our only combining form for mouth, but it's going to be our first one. The most common term we have is oral, which means pertaining to the mouth. We move on to our next combining form, stomato. A word of caution on this one. This often gets confused with stomach. Stomato does not mean stomach, it means mouth only. And its combining form, as you see here, can create the words stomatitis, which is inflammation of the mouth, stomatoplasty, which is a surgical repair of the mouth, and stomatomycosis, which is a fungal disease of the mouth. So always keep in mind, And I know your mind's going to want to go to the word stomach because it looks so similar, but stop and consider stomato is referring to the mouth. One of the structures of the mouth is the lip. Chylo is the combining form. Chyloplasty is a surgical repair of the lip. And chylophagia is the biting of the lips. Let's look at that second word first. There's the phagia suffix I was referring to. So now you see the GI. GI is related directly to the gastrointestinal tract. Once again, biting, chewing, swallowing, all of that is involved as the first steps of the digestive process. So that GI, those letters there are really good to remember that chylophagia has to do with, or phagia in general has to do with the digestive tract. Chyloplasty, we see two representations of that over here on the left. We see a cleft palate on the far left. So that's someone who was born without a hard palate in the roof of their mouth. And you also have this sort of disformation or malformation of the mouth. Chyloplasty can help repair that. Now, this is a complicated process. It doesn't happen in a few steps. It happens in multiple surgeries. At first, they replace that hard palate on the roof of the mouth, because at this point, since there's no hard palate, which is the roof of your mouth, just to clarify, you have an opening right into the sinus cavity. This is complicated. This complicates things in a couple of ways. Primarily for the newborn, there's no suction available so that they can feed. So they can't drink milk that way. So they have to get nutrition another way. If this doesn't get repaired, it's not very conducive with life, which is not to say that someone wouldn't survive this, but the trick would be to figure out a way to nourish them so they could grow up healthy without having the ability to chew or to really swallow or to suckle off a breast, for instance. However, there are surgical steps, as I mentioned, and if you look at the picture just to the right of that, that is the same patient post-chyloplasty. Now, there's been other surgeries involved. As you can see, this child is aged probably a year or a little bit more, so there's been some time involved, but this is repairable. I had a good friend who had this surgery in the early 60s when he was born, and his didn't turn out as well as his son's, he was born in 2004, and it was done up at Stanford, and you can never tell he ever had a cleft palate. So the surgical process for this, although it's complicated, is accomplishable and can repair this permanently. And as you can see, it looks pretty normal. So that's what we shoot for, especially in surgical intervention. Halito, combining form for breath. The only word you need to know here is halitosis, which is bad breath. And so that's our medical term for it. I'll let you work with how you want to address that or what kind of things might fix it, but it usually has to do with oral hygiene. So that's something we're going to cover in just a moment. We're going to go ahead and pause this now because our first 15 minutes is up. I'll be back in just a few moments, and we're going to start talking about teeth. I'll be right back with you.